Hey, Dr. Geoffrey here, working the Saturday night shift. Decided I wanted to hop on real quick and just talk about what to do if you get COVID. It comes up because I've seen a few COVID patients, COVID patients who were home and they came in and as I thought about it, we've not spent a lot of time in the literature going over the top 7 things that we need to do when we're at home. I'm gonna give you the biggest one just up front for those people who have to hop off of this. If you're COVID positive and you're home isolating and you're treating yourself at home, while I have 7, and not necessarily in order, this is the one that we don't talk about much, but we do it in the hospital. When you lay down, you're COVID positive, you're sitting home. Well, first of all, and I'm gonna get to the big one. Well, first of all, this is not a time when you want to go home and get under cover and get all comfy. No, you want to be as active as possible. You want to keep those lungs extremely active. First thing that you want to do is lie prone as much as possible. Usually people lie on their back or on their side. You want to lie in your stomach as much as possible. We do that in the hospital now. For our severe to our mild cases, we have them lay down on their stomach versus on their back. Long story short, what that does is it helps ventilate more of your lungs. Because keep in mind, what COVID wants to do, it wants to take over your lungs. Second thing, you want to purchase yourself several balloons, blow them up 3 to 5 times every hour. Blow them all the way up. What that does is that it forces aeration of your lungs. It forces aerations of your lungs. And true, this is all stuff that you don't hear about, that you don't read about, but we are doing this actively in the ER. And then finally, how you sit while you're COVID positive means a lot. If you're slouched over like that, well, believe it or not, that collapses part of your alveolar. That's part of your lungs. So you want to sit up as much as possible. Sit up as much as possible. Again, the whole goal is to keep your lungs as active and aerated as possible. And you want to stay as active as possible. Now, back to some more basic things. By the way, that was the most important part that I just said. You want to do things like you want to take Tylenol if you have a fever. You want to stay well hydrated. That's very important. You want to stay well hydrated. Why? Because naturally, our body secretes mucus in our respiratory system. It helps our lungs move freely. It's a nice thin layer. It serves as a filtration as filtration for the large particles that are coming into our lungs. Whereas if we get dehydrated, our mucus gets thicker. It gets thicker, and it disrupts that natural filtration system. Therefore, it's important to stay very hydrated. Now, let me just say this: you may not have COVID now. You may not have a friend who has COVID, but at the rate we're going, it's very important for you to watch this video, because you may get COVID or you may get a friend who gets COVID, and you need to know how to treat them. And by the way, nothing I say should be taken as medical advice. This is just for information purposes only. I'm seeing patients in the ER tonight, and everyone needs to have a plan for how they treat COVID. Next thing is, have yourself some over-the-counter cold medicine. Have yourself some over-the-counter cold medicine. Take it as needed. Take it as needed. Then finally, talk to your doctor about your vitamin D. Vitamin D has been shown to be very helpful for respiratory conditions. Again, vitamin D has been shown to be very, very helpful. While you're waiting to talk to your primary care doctor, you can take natural supplements. For instance, dairy products are full of vitamin D. Fatty fish like tuna, mackerel, and salmon. It has a lot of vitamin D. And the most important symptom to watch out for as you're home isolating, the most important symptom, lean into this, lean in, is we're going to watch the cough and see if the cough progresses to shortness of breath. Why? Because shortness of breath is a sign of a worsening respiratory condition, because keep in mind, COVID wants to take over your respiratory tract. Reasons to go to the ER. Reasons to go to the ER, according to the CDC site. We just touched on one. Trouble breathing, persistent chest pain or pressure, new confusion, or difficulty to arouse, difficult to awaken, and bluish lips, or a bluish face. Those are all reasons to go to the ER. And let's deal with this in this video now as well. There are some things that you do not want to do. There are some things you do not want to do. While I shouldn't have to tell you this, cases are still happening. You do not want to take chloroquine or hydroxychloroquine. Studies, we're not giving that in the ER, and I would encourage you to talk to a licensed professional about that. Be careful about taking some of these over-the-counter supplements like ginger, grapeseed extract, cinnamon, grapeseed extract. While those are normal agents, taken in large quantities have known to thin your blood, make it more difficult for you to clot, meaning that if you get a cut, you will bleed more. And for those of you who already have asthma or you have a condition that requires you to use a nebulizer, that requires you to use a nebulizer, you already have it. You do not want to use it if you're COVID positive and you live in a house with other people and other people are around you. Why? Because you're just releasing active virus. You're releasing active virus. Some other things that you want to do for those people who are COVID positive and they're living in a house with others. Yes, of course, you want to isolate away, but well ventilating the house, meaning windows open, would be very helpful. Windows open would be very helpful. If there's a fan going, that's very helpful as well, because keep in mind, two big determinants about whether or not someone actually gets infected are the concentration of the virus, the viral load in the area, and how long someone is exposed. By having well ventilation, a fan going, windows open, it decreases the concentration. But in summary, most of us will either know someone who's COVID positive and who's home isolating, or we will become COVID positive ourselves. It's okay. It's not the end of the world. The data says that 97.8% of us do just fine. 97.8% of us do just fine. And if you're a child, 99.9% of children do just fine. I would just encourage you, listen to me on this one. Hear me out on this one. If you're COVID positive and you're home isolating and you're home treating, this is not the time to curl up and just wait it out. You want to be as active as possible. You want to ventilate those lungs as much as possible. You can't let the virus take you over. You've got to be active. Again, you want to keep the lungs well aerated. Hey, for more information, hit the bit.ly attached to this. It gives you a lot of information on, and it gives you a lot of the data and articles of items that I just presented. I just want to hop on because I've consistently taken care of patients who are home isolating or who are home treating because they have COVID, and they come in because they're not sure about this, or they've had worsening symptoms, or they just want to be reassured. But when you talk to them, they're missing the mark in terms of what they should be doing at home. Again, I'm Dr. Geoffrey, board-certified emergency medicine physician, a split-second decisions expert. Please reach out to me. I live in many organizations to give COVID updates. I'm also a trainer on executive decision making and have been leading a lot of blind spot conversations. But most importantly, be safe out there, look out for one another, and do something kind. And in the end, we're all going to get through this together. How? Together. Be safe and do something kind for someone. Dr. Geoffrey, I'm done.